This is going to be such an interesting conversation this evening because we really need to learn the impact of sleep. So many of us are sleep deprived. We're working, especially in this after the pandemic. We're trying to catch up financially. Many of us have changed jobs. Some of us are now working two jobs, maybe even more. But you still need to have, we'll learn how much sleep is the best amount of sleep in order to keep us healthy. So that's what this is all about this evening. So asking everybody to do this pre-survey for us. And again, there's no right or wrong answers. We're going to ask you to do these same 4 questions at the end to make sure that we've hit our mark, so to speak. We have just 30 seconds left on the poll. Thank you very much to Tamisha Major and also Michelle Blackwell. They're the ones behind the scenes driving this entire event this evening. You won't be able to see them, but they are with Center for Change. And we thank them for the phenomenal job they did in putting this all together. So if we can, we'd like to begin. Our doctors this evening for the benefits of sleep on cardiovascular health are right there before you. Dr. Colin Watts, Dr. Amish Parikh, and Andrea Spencer is our nurse this evening. Dr. Colin Watts is a Detroit native, where his passion for science initially led to his planning a career in medicine while he was still in high school. He's a graduate of Wayne State University, the School of Medicine. He came to Florida in 2012 to work as a hospitalist and a nocturnist. You're going to find out what that is in just a moment for the Orlando Health and Advent Health Systems. His work there led him to care for the elderly and nursing home residents. He took great care as an undergraduate to offer an extra ounce of care to first-time cancer patients, where he helped them along with their families get settled in that undaunting time. He tried his best to make their clinical visits a little more welcoming and a more comfortable experience. And this type of one-on-one patient care contact has proven invaluable to him throughout his medical career. In fact, as a primary doc, Dr. Watts prides himself on offering this special care and says, actually, that's the favorite part of what he does. That's good to hear. Amish Parikh, MD, is a Central Florida native and University of Miami alum. Dr. Parikh attended medical school at the University of South Florida. He completed his residency at Miami's Jackson Memorial Hospital and his cardiology fellowship at the University of Florida Shands Hospital in Jacksonville. He has practiced cardiology here in Central Florida since 2000. He enjoys privileges at both Orlando Health and Florida Hospital. Now, Dr. Parikh also takes a patient-centered approach to heart care to understand the root cause of all of his patients' disease to disorder. And that helps them define a path of medical treatment, and most importantly, to partner with each patient in their longevity by inspiring a healthy lifestyle at any age. He serves on the board for the Orange County Medical Society and a gift for teaching. And if that's not enough, his service to the Indian American Chamber of Commerce ramps up each year as he leads a team in production and promotion of what the Orlando Magic call the best heritage night in the NBA, Orlando Magic India Day. And Dr. Parikh, I just finished doing the Black Business Summit with the Orlando Magic today, so I spent my day with them. And last but not least is a woman after my own heart. She followed in her mom's footsteps and several other relatives to become a registered nurse. Andrea Spencer has over 25 years of medical experience and has worked in various positions. She moved to Florida from New York. That's where I say a woman after my heart. I'm a New Yorker, where she continued her career in long-term care, I should say, initially as a floor nurse. She quickly moved up the ranks, holding positions such as supervisor, unit manager, assistant director of nursing, and director of nursing. She also has a bachelor's in accounting, and Andrea is passionate about community outreach as well. She's actively involved in numerous committees that aid the underserved as well as the senior population. There you have our esteemed panel. Let's get started with our first slide.
Okay, so let's talk about the facts. Cardiovascular diseases are the leading cause of death in the world. Bet you didn't know that. Most cardiovascular diseases can be prevented by adopting healthy behaviors. The heart likes consistent sleep schedules. Sleep affects the heart. Quality of sleep really matters. 50 to 70 million adults in the US don't get enough sleep or has a sleep disorder. Hypertension, stroke, coronary disease, and irregular heartbeats have been found to be more common among those disordered sleep than their peers without sleep abnormalities. Don't sleep on the facts. Did you know that 1 in 3 adults do not get enough sleep? I know I don't. How about you guys? Are you sleeping enough? Poor sleep may place you at a higher risk for cardiovascular disease, high blood pressure, high blood sugar, high cholesterol. Poor sleep can also cause breathing problems. Do you have difficulty breathing while you're sleeping? Are you snoring loudly? Are you disturbing your spouse or your significant other while you're sleeping? Stress, memory issues, inflammation. These things happen because of poor sleep. They say that adults need anywhere between 7 to 9 hours of sleep each night. I know many of us are not getting that much sleep, but we should be. Let's try to reprogram our schedule so that we are sleeping more hours so it can reduce our risk. So now they have done sleep statistics. And with the sleep statistics that they've done in 2020, the prevalence of short sleep among US adults, men rank the highest in not getting enough sleep at 47%, followed by non-Hispanic, Black, or African Americans, 43.5%. Then finally, we have adult males between the ages of 25 to 44 at 36.4%. Now, you may not fall into that rank, but women, you're coming right behind. We need to make sure that we are sleeping enough. That is a part of the self-care that we need to do so that we don't fall in this high rank and be at risk for cardiovascular.
So now is when we always say, ask your questions, ask your questions. You can put them in the chat and we'll make sure to get to them. One of the things that Andrea said is that lack of sleep can lead to cardiovascular issues, just so many things, high blood sugar, all kinds of things that we present in the office with, especially as African Americans. So feel free, like I said again, to put your questions in that chat. We'll move on to the next slide.
Okay. If you have trouble sleeping, you can try this. How to get better sleep. There are things you can do to help you rest easier at night. So number 1 is maintain a routine sleep schedule. It's good to set a schedule, go to bed and wake up at the same time every day, even on weekends. and it's important to maintain a consistent sleep-wake schedule and to practice proper sleep hygiene. Number 2, set the mood. Sleep in a cool, dark, and quiet place. Creating a relaxing sleep space. Make sure your bedroom is cool, quiet, and dark. And number 3, refrain from using electronics right before bed. Turning off devices that create blue light, like smartphones and tablets, can help you rest and sleep better. Number 4, do not drink caffeine or alcohol or eat large meals at least 2 hours before going to bed. It's important to watch what you eat and drink. Try not to have anything too close to bedtime, especially those caffeine, alcohol, and foods that are high in fat and sugar. And number 5, exercise during the day for better sleep at night. Get natural light. Exercise. So you can exercise by taking a walk in the morning or around lunch, but avoid working out within a few hours of bedtime. It might keep you from getting the sleep that you need. And if all else fails, you can contact your primary care doctor. So if you often have trouble sleeping, talk to your doctor. They may be able to help you figure out the cause of your sleepless nights. And that can give you back that restful sleep that you need. So, preparing for the talk, it's always a good idea for patients to write down all the symptoms and questions that they want to ask their primary care physician or doctor during their doctor's visit. This helps us out with obtaining an accurate history and physical from the patient and to hone in on the important parts with regards to their sleep history and their sleep symptoms. These questions include examples like what sleep issues am I experiencing, and then for how long this has been going on? When did I first notice these symptoms? What does a good night's rest look for me? Again, each patient is individual and they have their own experiences with regards to sleeping problems at night. How does my sleep issues affect me? If you're not sleeping well or having issues during the night, how does it affect how you perform during the daytime and how you relate with other people and work experiences, life, and jobs? How long does it take for me to fall asleep? Patients have issues where they lay down in bed and then they are awake, lay awake, wide open, eyes wide open in bed for 2 to 3 hours before they even fall asleep. So there may be some background issues which may be causing that. Do I feel refreshed when I wake up? If you have broken sleep during the night, getting up, using the bathroom, urinating multiple times during the night can cause broken sleep and interfere with your sleep, causing you to be groggy in the morning. Am I feeling stressed, anxious, or depressed? Again, behavioral health and mental health issues and disease can impact your sleep. Am I snoring or gasping loudly during my sleep? This is if you have any pulmonary or respiratory breathing problems that can be interfering with your sleep, such as orthopnea, having to be propped up on pillows or sleeping in a recliner at night so you can breathe enough to fall asleep, or if you're breaking up during the night, gasping for air or choking, which is called paroxysmal nocturnal dyspnea. These symptoms come from pulmonary issues such as sleep apnea, or maybe you might have congestive heart failure.
So what we're saying to you is that not that you'll have to have a little notebook by you, but when you are feeling any of what Dr. Watts said, all we need you to do, take note. How am I feeling when I wake up? Do I feel refreshed? Do I feel ready to start my day? Everybody wants to hit the alarm clock a few more moments to snooze, snooze, snooze. But once you get up and going, how are you looking even? I know for women, Are you saggy? Do you have a lot of does it look like you rested? Eyes puffy? All of these things are what Dr. Watts is saying could be a problem. So next slide, please.
All right. Embrace life's essential weight. So managing blood pressure. Poor sleep has been linked to high blood pressure. Atherosclerosis, or clogging or hardening of the arteries, that is associated with coronary artery disease, heart failure, heart attacks, stroke, diabetes, and obesity. Losing and managing weight. Sleep loss slows down your metabolism, how your body converts what you eat and drink into energy. When your metabolism is slow, you have trouble losing weight. What's more, you don't feel like exercising. Both of these can contribute to obesity, which can lead to high blood pressure, high cholesterol, diabetes, and heart disease. Next, eat better. Research shows that when you're robbed of shut-eye, you're more likely to crave junk food full of salt, sugar, and fat. Too much of any of those things is bad for your heart. Again, so loss of sleep leads to poor eating choices. Next is get active. It's good to exercise and maintain activity throughout the daytime so you can enjoy restful sleep during the night. Again, it's a good idea to avoid exercising right before you go to sleep, because that increases your blood pressure and your heart rate, will prevent you from going to sleep if you exercise right before going to bed. Next, quit smoking. Nicotine, cigarettes contain nicotine, which is a stimulant, and that causes vasoconstriction of your vessels, which can lead to high blood pressure. And again, when that happens, stimulants and high blood pressure prevent you from falling asleep.
Okay.
Controlling cholesterol and managing blood sugar. These are important and they go hand in hand. High blood sugar and high cholesterol interferes with sleep and causes other issues and damage to your vessels, and high blood pressure interfering with sleep. And get quality sleep. It's always important to maintain a consistent sleep-wake cycle and to practice good sleep hygiene before you go to bed. Again, turning off all electronics, staying away from playing around with the cell phones, keeping a cool room environment.
Turn the television off.
Yeah.
Turn the television off.
Exactly.
Yeah, so thank you very much. Still want to see your questions there. Sleep stress. When we look at this, I just wanted to go through this really quick. This is key for your heart health. What's going on at your job? What are you bringing home at night? Leave it there, please. Anger. How are you managing your anger? This has a big effect on how you're going to sleep. Traumatic events actually can go into that. Negative thinking. Ooh, we've all gone through that. That negative talk that we have in our head going off on this side. How about this side being that positive effect? Anxiety, depression often go hand in hand. Loneliness as well. And I'm always concerned with loneliness when I think of our elderly. And I know that you all have a lot of care for those who are elder, our seasoned people, but data suggests that treating mental health can actually improve your heart health. We've got one question. How safe is frequent use of things like melatonin and other sleep aids?
Melatonin. So melatonin is over the counter. It's a natural substance. You don't have to have a prescription for that. You can buy it over the counter, and it's a supplement that you can try to see if it helps you sleep at night, as opposed to a prescription medication. So it's always a good idea, I would say, for patients to start out, try melatonin first and see how that works. If that doesn't work, then we can we can escalate up to a prescribed medication for sleep.
Should it be used on a long-term basis or just temporarily?
Melatonin can be used on a long-term basis, yeah.
Mhm. Now, things like melatonin and any other sleep aid, they may help you fall asleep, but how do you feel when you wake up after you use the sleep enhancer?
Mhm. So again, yeah, every patient's different. So I get different responses from patients on those type of medications, over-the-counter stuff, over-the-counter medications like antihistamines, stuff like Unisom, Benadryl, melatonin. It depends. Some patients say they work great. Other patients say they don't work at all. And some patients say that, oh, when I take these, I wake up groggy feeling tired, and I don't like that. So
Does it depend on when you take the sleep aid?
Yeah.
it does, yeah. So
Okay.
it's best to take it right before bedtime.
But at least giving yourself a good 7 to 8 hours, right? Because
Yes.
if you take a sleep aid and you're trying to wake up in 4 or 5 hours, I don't think that's a wise thing.
No, that wouldn't work. So yeah, you have to give 7 to 9 hours of sleep, 7 to 9 hours before you take the medication. Make sure
At
you
least giving yourself 7 to 9 hours to be asleep.
exactly, yeah.
Mhm, mhm. Next slide, please. And we'll probably jump into some questions. What type of test might you prescribe before making a referral to the cardiologist? That's a good one.
Okay. So the type of studies and tests I order for our patients before making a referral to cardiologists is, getting a good, history and physical examination. We order blood tests like comprehensive metabolic panel and electrolytes, hemoglobin A1C to check for diabetes. We order fasting blood glucose, fasting lipid panel to check their cholesterol levels, and also CBC to check their hemoglobin levels to make sure they're not anemic. So all of those blood tests give us a good direction of where we're going. Does the patient really need to see a cardiologist? I can manage it myself, or do I see any red flags? We'll have to refer to cardiologists. We also order EKG for our patients. When we order 2D echo, we can order a 2D echo for our patients if any of those red flags come up. And what I mean by red flags, that's like if they present with chest discomfort, chest pain or pressure, shortness of breath, problems breathing, if they're experiencing heart palpitations, heart racing, or any type of arrhythmia symptoms, and also if they have episodes where they faint or pass out, which is called syncopal episode, or if they have near syncopal or near fainting episodes, and also fatigue and weakness. Those are the red flags. We order 2D echo and consider referring to a cardiologist. And we also keep in mind of pulmonary lung function too. We order pulmonary function tests or PFTs for our patient just to determine if their breathing problem is disturbing their sleep, such as obstructive sleep apnea, or if they have maybe an early onset of congestive heart failure type symptoms.
So there are symptoms that can be detected if they have early onset of congestive heart failure.
Yes. Oh yeah. You'll see main things: shortness of breath. They might have swelling in the legs, exertional dyspnea, where if they go walk or go upstairs and they get short of breath and tired, have to stop.
Okay, I got an old wives' tale for you. Drink a cup of more milk if you can't sleep. How true is that? And if it is, why?
Well, so they say, well, here's the information behind it, because they say when you warm up milk, it activates the tryptophan in milk, and of course, tryptophan is that chemical here makes you fall asleep if you eat a lot of turkey.
Yes.
Drink warm milk, activates tryptophan in milk, and that's where that comes from.
Ah, okay. All right. So we're moving on now. Go to the next slide, please.
All right. I want to thank you guys for this is Dr. Parikh. I want to thank you guys for allowing me to talk about this topic. It's actually really near and dear to me because many people that know me know I have a lot of energy, and sleep is actually the worst part of my day because the couple things we didn't talk about. Number one is arthritis, right? So I've been doing surgeries for 20 plus years now, and I developed a lot of arthritis in my neck. And so when I fall asleep, so a lot of our patients, they have arthritis. And when we don't move, it causes us when we don't move at night, it causes us to have to move around because the pain hurts, right? Even though we don't wake up at night, we're fiddling, we're moving around, okay? So that's something that affects me tremendously. And we'll talk a little bit more about that. And then acid reflux, right? So as we get older, we get acid reflux. And so that it's hard to lay flat. And so that's one of the things that I see, that if I eat too late at night or a little more alcohol than I should or more stress than I should take, I'm going to get some acid reflux, and that also wakes me up at night or keeps me from getting that 7 to 9 hours. So in this first slide, we're really going to talk about, there's two cycles when we fall asleep, okay? It's called REM, rapid eye movement, and non-REM, okay? So 20% of our sleep cycle, our sleep time is in the REM cycle. This is the actual cycle where we dream. This is where we actually do the most recovering, okay? We need sleep to recover our energy, to build energy up, okay? At this time, our body is actually at having its lowest heart rate, its lowest blood pressure, its lowest breathing. We're in a state where we're using less energy to live, all right? This reduces stress on the heart and on the whole body, including the brain, kidneys. And so this is a really key moment for us. Unfortunately, this is also the moment where conditions like sleep apnea come into play, and other things like heart failure, because we're really not using our muscles. So when I explain sleep apnea, one of the questions is, what's sleep apnea? So what I want you guys to imagine is when we go into this REM sleep, the muscles in our body are the most relaxed they're going to be. Now, the muscles around our breathing tube, the trachea, also relax. And this allows the fat around our necks and in the back of our throat to collapse upon the breathing tube. And this is when we snore, because now we're trying to get air into our breathing tube, but there is either fat behind the neck in the throat area or around the neck. So we see a great deal of patients that have sleep apnea that are obese, right? Well, I'm going to tell you, you're looking at someone with mild sleep apnea. I also have that. It's another reason I don't sleep well. So I have a little bit of extra growth in the back of my throat, whatever. So when I sleep, so I use a mouth guard. Okay. So what happens is during REM sleep, the muscles relax around the breathing tube. The fat around the breathing tube starts choking you. Your oxygen level drop. Your brainstem says, "Wake up, dummy, you're dying," and you get kicked out of REM sleep. So when you're supposed to be in the most restorative state, you're actually the most in disarray because you're trying to live. And that's why a lot of us have to be force-fed oxygen with that CPAP mask. It forces oxygen down during REM sleep to overcome the fat around our breathing tube. Or sometimes some patients have to have surgery to open up that airway because it can get really bad. And so what happens, and not just only sleep apnea, but that's the extreme version of poor REM sleep. Sleep apnea has a lot more effect on the heart than it does the lungs. So many of us have sleep apnea, diagnosed or undiagnosed. Usually your spouse will tell you you have sleep apnea because you're very restless, because you're being awoken by your brainstem, "Wake up, dummy, you're dying." You are moving around a lot. You're snoring like crazy. And for many of us, we wake up tired. We can be in bed for 9 hours and we're not awake. Sleep apnea doesn't have to wake you from sleep. It just kicks you into the non-REM area. So we think we had a great 9 hours sleep, but we wake up and we're tired. Some of you guys out there, I can diagnose sleep apnea based on how much coffee you drink a day. So those guys that are drinking 4 or 5 coffees or more, and then when you ask them more, you ask them why. Oh, otherwise I'll fall asleep, right? So that's another thing that Dr. Watts and I are looking for. You don't realize it, but you're having to use a lot of caffeine. Or you're one of those people that when they're at a boring meeting or they're watching TV or sometimes even having conversations, they fall asleep. I'm sure we all know uncles, aunts, and parents that do that. So that's another telltale sign, right?
Yeah.
And then an extreme sign is when you fall asleep at the wheel, right? So we see that with truck drivers a lot. Unfortunately, I don't want to say it, but many truck drivers are obese, right? And so that's what the worst case is, when people that are driving fall asleep, because it's a mundane, very monotonous setting. And if you fall asleep that way, you definitely have to be careful of sleep apnea. Okay. We'll go to the next slide.
While we're going to the next slide, I've got some quick questions for you. Dr. Parikh, are headaches a reason of not getting enough sleep? Is that a telltale sign?
Yeah, I think that it's important that we overlook it. Being personally a go-getter for so long, I jinxed myself. I said sleep is overrated for decades.
I said that too. Yeah.
Right? And I always thought sleep is overrated, and then God kicked me in the butt and said, no, it's not overrated.
Right.
Because when I don't sleep well, I'm living on more adrenaline. Okay. So one of the things that happens is when you're supposed to be sleeping and you're kicked out of that sleep zone, it's because the brain stems increases your adrenaline level, sympathetic nervous system goes up. So your heart rate and blood pressure go up. So that can cause headaches. So if your blood pressure goes up because your sympathetic nervous system's going up, and you have to work harder because you weren't able to get that restorative sleep. So that definitely.
Go ahead. If you have heart damage as a result of sleep apnea prior to getting a CPAP, can you ever repair that damage that was done to your heart?
So this is interesting. I mean, I think that when we think of damage to the heart, sometimes congestive heart failure, sometimes blockages, sleep apnea is not the number one cause, right? So blockages are going to be the number one cause, okay? So sleep apnea is going to exacerbate these problems. Now, one thing I'll tell you is not really thought of. I think a lot of you guys have heard of atrial fibrillation.
Yes.
So 20% of Americans above the age of 65 have atrial fibrillation. This is a regular heartbeat. That's why you see all those commercials for Eliquis, Xarelto, Pradaxa. These are the super blood thinners that prevent you from having a stroke. Atrial fibrillation is a heart rhythm that makes the heart beat out of sync. And when the heart beats out of sync, blood doesn't move well. And when blood doesn't move well, it clots. So atrial fibrillation leads to strokes. Super common cause, not top 2 cause of stroke in our seniors. Now, guess what? Sleep apnea triggers atrial fibrillation. So the atrial fibrillation in obese patients is definitely something that I look for, because if you have untreated sleep apnea, medications, and even sometimes when we do ablations, will not work because sleep apnea is not treated well. Okay. So yes. So sleep apnea, sleep disorders lead to increased heart rate and blood pressure, which can lead to increased blood pressure, increased arrhythmias, palpitations, and cholesterol and inflammation. That's another thing that's really big when it comes to having the sympathetic nervous system activated, right? I'm really big now lately on chronic pain. God has given us a lot of tools for strokes, heart attacks, and cancer. And therefore, 100-year-olds are the fastest growing population in America, right? You go to church, you're going to see 90-year-olds left, right, and center,
Yeah.
right? I saw 7 90-plus-year-olds just on Tuesday, and 103-year-old, super active, excellent, right? We all know that. And once we go back to church, you're going to see them walking around. But what's left? Dementia and chronic pain. Okay. So that chronic pain is a sign of that increases adrenaline. So a lot of us get used to pain. We don't show it, right? It's just become part of us,
So true.
right? But your body feels it. And that increases your heart rate and blood pressure level. In your blood, it increases your cortisol levels, your adrenaline levels, all the while keeping your body revved up. Sleep does the same, lack of sleep does the same thing. And
Wow.
so it's important. We can go to the next slide because we talk about it there. Is that this poor sleep leads to this inflammation. We have to get restorative sleep. We have to recover energy, restore, and more importantly, gain energy, right? So when we don't gain energy, when we keep our bodies constantly stimulated, we increase inflammation. So for my seniors, I tell people every day, every year you wake up with less and less energy, right? And everything we do in the day takes away from that energy you wake up with. The only thing that increases energy is cardio aerobic exercise and sleep. So now I'm making sure that all my patients, even my 90-year-olds, get 2 hours of cardio aerobic exercise a week. And I'm starting to move some of my patients that aren't doing well to naps. Half the world
I
takes
like
naps,
those.
right?
I like those. Listen,
That's right.
gotta tell you, naps are rated very high, and you have to do it. I don't know if you wouldn't know this, but for many years, 13 to be exact, I was getting up at 3:30 every morning and working 12 to 15-hour days at a radio station. It took its toll on my weight. I developed high blood pressure, high cholesterol, and diabetes. I'm happy to, and sleep apnea. I'm happy to say I'm losing the weight. I've been off the air on a regular basis now, going on 3 years. I walk more, I have more time for myself. I sleep better. So be really careful at what we call being so productive on these jobs. Make sure you're maintaining you and doing that self-care. We said that earlier. Andrea said that earlier too. So thank you. So we can go to the next slide. I think it's going to be questions for us, but
yeah, no worries.
Okay.
And then, very simple. When you increase the sympathetic nervous system, increase heart rate, blood pressure, you make the heart work harder. So that can trigger chest pain because we want the heart to work more efficiently. We want to do things that, obviously, most of life in America is stressful, right? Even if you watch the TV or listen to the news or on the radio, it's stressful. So there's very little in our lives that aren't stressful. Traffic, caring about the grandkids, you're worried about this, you're worried about that, So all these things have an effect, and it causes the heart to work harder. And if you have a compromised heart or your blood pressure gets too out of control, diabetes, that can trigger chest pain or angina, which is when the heart doesn't get enough blood flow.
I would ask, does the angina always mean that there's heart issues, that you're in line for a heart attack?
Well, so what I tell people is chest pain is very nebulous. It could be many things, right? Acid reflux, pneumonia. How you could even have I tell people you could have a knife in your chest and you're having chest pain. What does that got to do with the heart, right? So angina is specific. When your heart doesn't get enough blood, it causes that heart to be discomforted. So the classic symptom is an elephant sitting on your chest, going to the left jaw, left arm. Well, guess what? That only happens 30 to 40% of the time. Many of our viewers that have had heart conditions know it can be shortness of breath. It could be acid-like symptoms. It could be shoulder pain. It could be so many different things. So angina is specific for the individual. What is your symptom? And you have to have had a blockage. And yes, it can lead to a heart attack. Angina can lead, it is a warning sign. So definitely, not always does angina lead to a heart attack, but it's, you got to listen to your body. Colin, you're mute.
Yeah, yeah. So yeah, the benefits of sleep. So less risk of chronic disease. So quality sleep, in addition to exercise, stress management, and healthy eating choices is an important part of maintaining healthy weight. During sleep, the body naturally produces more of an appetite suppressor called leptin, while reducing production of the appetite stimulant ghrelin. On nights of too little sleep, however, production of this hormone ghrelin increases and leptin decreases. As a result, a lack of sleep can lead to a greater feeling of hunger, and that can lead to unhealthy choices, eating salty, fatty, sugary foods. Better ability to build muscle. Sleep is a key element of athletic recovery, and the body's production of growth hormones is highest during sleep. These growth hormones are necessary for the repair of tissue and likely contribute to the muscle growth. Most athletes require 8 hours of sleep each night for restoration and to avoid overtraining and improve their performance. Better brain functioning. Improve mental function. Sleep is believed to help with memory and cognitive thinking. Brain plasticity theory, a major theory of why humans sleep, posts that sleep is necessary so the brain can grow, reorganize, restructure, and to make new neural connections. Updating these connections in the brain during sleep helps individuals learn new information, form memories, and quality sleep leads to improved concentration and better problem solving and decision-making skills. So in other words, a good night's sleep can increase your daily productivity.
Next slide, please.
Well, yeah, okay. So is it?
One of the questions that came up, what should I expect when I go see the cardiologist? I think if my PCP said, Monica, your test results are in, we're going to have to send you to a cardiologist. I think my first thought would be to panic. You laugh, Dr. Parikh.
I know, I get you, Monica. Listen, I've been doing this a long time. My first reaction, it was a smile and a hug. That's what you should expect.
Aw.
That's what we want. That's what we do. That's the way I practice. Yeah. So,
yes.
And that's not the typical, but that's what you get when you come to the office, because we know it's very scary when someone tells you you have to go see the cardiologist. And I'm very aware of that, keenly aware. And so is all my staff. You know, we want to make sure that we're building relationships. You know, we're not here to doom and gloom. You know, God, like I said before, God has given us so much opportunity. I tell people every day, like probably 5 to 10 times a day, any other country in the world, you'd be dead. But God blessed you to be in America, where we have access to the cures and we treat seniors, right? So if you're in Africa, Asia, most of those countries, you got to pay in advance to get a stent or to get medications. You even get in the hospital. In India, you pay up front, then you go to the hospital, then you get admitted. Or if you're in Canada or in England and you're a senior citizen, you're waiting in line.
Yes.
Right?
What is that about?
Yeah, well, because there's only so much resources, right? People complain about the medical care in America, but why are 100-year-olds the fastest growing population in America, right? Most of them have had to overcome strokes, heart attacks, or cancer. And that's not always a God-given right in Africa or Asia or in Canada and England. They cap their resources, or they don't have it in Africa or Asia. They may not have the ability to treat all these patients, right? So we do, and that's why our patients are just growing. You know, every patient I see, I tell them, you're going to live until 100 plus. That's my goal, and I don't pull punches. So that's our goal.
One of the questions, Dr. Parikh, is when should you go see a cardiologist? Regular routine, or if there's a problem?
Well, I think this is an issue. I tell people all the time, we go for mammograms regularly. We go for colonoscopies regularly. Men get prostate checks regularly. Unfortunately, I blame the American College of Cardiology. They only recommend EKGs, and EKGs are not very accurate. Dr. Watts knows that unless you're having an acute heart attack or having an irregular heartbeat, EKGs have like a 10% accuracy for looking for chest pain, for looking for blockages. It's very inaccurate, okay? I think that Dr. Watts knows we have a great relationship when we have our seniors that have multiple risk factors, including blood pressure, cholesterol, diabetes, especially. You know, a good baseline cardiac evaluation is important. That includes a stress test to look for blockages and an ultrasound of the heart to look to see how strong your heart is and the valves. Unfortunately, I can't tell you like colonoscopy. GI guys can tell you every 10 years for a colonoscopy or mammograms. The cancer societies are much stronger than the cardiology societies. But I think as my patients, I'm always telling them that your health is your responsibility. It's not mine. You know, I can only do so much. So when should you have it? If you're 65 and older and you haven't had one, if you're not active, then you want to get active, meaning not walking. I'll tell you that about in a second. Then you may want to talk to your primary care and say, hey, Dr. Watts, what should I do? You know, if you're already active and you're doing 2 hours a week of exercise, you know, it's always it's something you have a discussion with your primary. That's what I tell people. There's no guidelines.
Mm-hmm. This is the question for Andrea. When the nurse checks your vitals at the during your appointment, what's a normal heart rate? What should your heart rate be?
So,
Uh-oh.
are you still hearing that?
Yeah. And with Dr. Watts. Are you
Yes,
all, huh?
Yeah, so a normal heart rate is between 60 and 100 beats per minute. So that's the normal heart rate we look for.
Mine is always a little bit above 100. So yeah, okay. All right, let me see. I think I have one more question down here. Okay, that was that one. Let me see. I think there's one more. Okay. All right. So the last two you answered, and that was when should you go see a cardiologist and what would the normal heart rate be? We love these questions from you all. Just put them in the chat. Put them in the chat. The doctors have a few more minutes with us. Hopefully by now you feel comfortable enough to ask your questions. Remember, there's no right or wrong. We're here tonight for you. So make sure you ask us all that whatever comes to mind. So, Dr. Parikh, would we only be able to come see a cardiologist through a PCP, or would we be able to make an appointment with you? Because you said a baseline.
Yeah, so I think from the perspective, it's all about insurance, right? So many Medicare, so these are mainly seniors we're talking to. I always, I have great relationships with my primaries in town. So definitely talk to the primary care. If your insurance allows you to, like Medicare, if you have Medicare with a secondary, you're more than welcome to call the office and make an appointment. Some of us have commercial PPO plans. More than like what I tell people is just call us, and my staff will tell you right away, do you need a referral or not? We're not going to see you and start incurring anything until we get the right authorization. But my main thing is, if you're 55 and older, you want to be active. I have a saying that the heart is the engine of the body, right? Its job is to push blood full of oxygen and nutrients to the rest of the body. If you're pushing your heart 10, 20 miles an hour, you don't really know what's going on with your heart. But if you're doing 50, 60 miles an hour and your heart's doing good, that's a good sign, And that's why it's always important, with or without heart disease, that you guys do moderate cardio aerobic exercise, and you do it for 2 hours a week, 30 minutes at a time. Work your way up. Might take you a year to get there. Work your way up. And if you're not exercising, definitely, and you want to, then definitely get your heart checked before you go and do that kind of stuff.
Has there been any linkage to heart disease as a post-COVID-19 condition?
Oh, yeah.
If not,
So definitely. So that's a great question.
How does a patient get the adequate
Yeah.
care?
It's
for
something
this
called
long-hauler condition?
So there's 2 phases to COVID. There's the acute phase, okay, where COVID, we know it for pneumonia, right? We know COVID pneumonia, but there's a small group of people that get COVID cardiomyopathy, which means the heart weakens, okay? So the COVID vaccine, a COVID virus can attack the heart and make it weak. Now, the other thing that happens is, remember the lungs and the heart work together to provide blood and oxygen to the body. So when your lungs get affected, it makes your heart work harder. So oftentimes when we have bronchitis or viruses and fevers, your heart rate's going to go up because the heart's trying to compensate, okay? So there's a lot of patients that had COVID pneumonia that triggered heart failure or heart attacks. That's the early onset. That's the acute phase. And then we have a second phase called the post-COVID phase, right? Or post-COVID, which is you go through COVID, it's usually mild or moderate, and then things get better. And then about 3 to 6 months later, all of a sudden, you start getting that foggy memory, you start getting weakness, and patients' heart rates and blood pressures are going up for no reason. So they feel like they're running a 100-yard dash, but they're standing still. Right? So I have, probably 20, 30 patients like that. And many of them young. My youngest was 21. My first and youngest was 21. So
was that COVID related?
100% COVID related. He was a senior at UF, University of Florida, and was running 5Ks and then 6 months after his COVID, he couldn't walk around the sofa. Mom had to bring him back home. And then I talked to him and made sure the heart was fine, but he had what we called autonomic dysfunction. The body couldn't regulate if you were sleeping or you're awake or running. And so he was sitting still and his heart was running a 100-yard dash. So we got him better. We got him on meds. He's in law school now, so the kid's doing great, but he's still on the medications a year and a half later.
Now, is that something he'll have to do forever?
We don't have enough data.
You don't have
COVID's only been around 2 years. So we tried before he went to college. Went to law school. I tried to take him off the medicine and his heart start racing. And I kind of, because he's in DC, I got him to see some doctors there, and they'll try it again. I'm hoping a lot of these illnesses, viral related, resolve later on, but COVID is it's a new thing for all of us. We're learning as we go.
It's 7:27 right now. And as I say, always, for the sake of time, we don't want to take too much of yours. I think that we should get, if we can, for sound purposes, just a 30-second wrap up from all of our doctors. But if we do have some more questions, I would love to hear them. So we're going to do that post-test again and make sure. I'm going to check right now if we've answered every single question, and I believe we have. Okay, so scary is what Christine says. Is low-dose aspirin still a good prophylaxis?
$1 million question. So I tell people for 23 years I've been in practice, plus 6 years being a doctor in training. So for about 20, except for the last year, everyone that was over 55, I gave them an aspirin, baby aspirin. Okay. So for 95% of the time that I've been practicing, and including myself, when I turned, when I turned 50, because I have a strong family history of heart disease, I took aspirin. So now what's happening is we had a study that showed for patients that don't have any heart disease, okay? So if you have a stent bypass, you've had a stroke, you have to take aspirin. You're done. This is not for you. This is for what we call primary prevention, to prevent the first stroke or heart attack, should you take aspirin. And what the study showed basically is that if you take aspirin on a regular basis, there was benefit in reducing stroke and heart attacks, but there was also a slight negative in terms of gastritis, in terms of bleeding, right? The job of aspirin is to thin your blood, okay? So if you have a weak stomach, if you get gastritis and you're just trying to prevent a heart attack or stroke, it might not be a great combination for you, okay? But if you're like me, that has a strong family history of heart disease, I went from taking aspirin every day to like 2 or 3 days a week, okay? And make sure I take it with food. There wasn't like more death, there was benefit, okay, to reducing strokes and heart attacks. It's just that a little bit more bleeding complications than we thought of, right? These are the same people that said don't do PSA, tests.
Okay.
This is the same group that said don't do PSA in all men because you're only saving so many people, right? This is the same group that said don't do mammograms in women below the age of 40. So you have to be careful where we're going in medicine, because I'm an old school guy where we treated everybody like they were our mother or father and brother or sister. We did what we needed to do, right? And to save a life, as long as I wasn't killing anybody, was very important, right? To prevent someone, yes, there may be more patients that have, cancer treatment than needed, but you don't know which one's going to die from prostate cancer and which one's not. And if we stop screening people haphazardly, you're making the choices that Canada and England are making.
There you go. So, Dr. Watts, I'm going to ask you 30 seconds to just wrap things up. If we have gotten to all of our slides, I think we're going to get to just some information pieces next. But I wanted to, while that screen is up and you can reach out to all of the people and even get more written information from the CDC and the Sleep Foundation on some of the things that we talked about in the American Heart Association. One thing that Dr. Parikh said when we first started, or midway through, he said, your health is your concern. Don't leave it up to your doctor. Make sure that when you go and see your doctor, you have all your questions written down. And something else, if you're a senior person, take somebody with you, because your ability to understand everything, you're in the moment, and another person sitting with you may have the wherewithal to write things down. And it's okay to say, could you repeat that? Or I don't understand that. Doctor's time, we value it, but sometimes it's so short. But if you come in there prepared, that perks them up. And that lets them know that you care about the care you're about to receive. So make sure you take part in your own health. We're going to